Happy September. I hope everyone's having a joyful month. It's a difficult month because kids are going back to school for our sandwich generation followers and everyone else who's just so busy in September. However, we're never too busy for our loved ones, especially our family members, our parents, and anyone we're caring for who's aged. So today I'd like to talk about unrealistic expectations and how in life there are so many of them, but even more so when we're caring for an aunt, an uncle, a mom or dad, or a spouse who's aging and has many difficulties. Could be dementia, stroke, cancer, whatever it is. We're just really hoping and praying they get better. However, sometimes our expectations are way up here and they are just aging in place and slowly declining. And we have to always check in with ourselves. Are we expecting too much? Are we putting too much stress on them too? Not just the facility or the in-home care company, the caregiver, whatever kind of, even the adult daycare facility. How are we in line and working as a team to make this village help this older adult age peacefully and comfortably? So for example, if someone's moving into memory care, your expectation should really be safety, monitoring, comfort, hopefully some participation in activities. However, if they were living at home and just watched TV, barely went out, was refusing to get out of their room, was refusing any kind of like mental stimulation such as playing cards with their grandson or not wanting to go to listen to music, most likely when they move in, there's not going to be that magic button that they go to 8 or 9 activities. Maybe, but it's quite possible that they're going to hopefully go to 1 or 2. So when you move in, try to be realistic, meet with the director or whoever it is and say, you know, my goal is for them to attend like our breakfast club meeting in the morning, or to walk their dog every day, 4 times a day, or just think of concrete goals that aren't so out there. Like, I want my mom to eat 100%, to never fall. Anyone with memory loss is a fall risk. There's no way around it. Anyone with Alzheimer's disease or any dementia, there's a risk of falling. Hopefully it's never going to occur, but could it occur? Yes. So be prepared, especially in a larger facility. Smaller facilities do have less falls because they're in a group setting usually, and you can get to the older adult very fast. However, in a larger building where it's space, you really have to check in. Also, if the building has different levels of care and you're not willing to go with their plan, say their plan is mild people are in one level of the building, moderate are in one area, and then maybe later stage residents would be downstairs or wherever they have another unit where they have more care, and you're thinking, I don't see my mom there. I don't see my mom in the lower level care, even though she's non-ambulatory, incontinent, so forth. I want her upstairs, maybe in that higher functioning unit. You really need to think then, do I need to provide more care? Because maybe their higher functioning is going on bus rides and going playing bingo, and your mom's not capable of that. And it could be spread out so that we can't get to her fast enough. So maybe you need to provide extra care. And you're more than welcome to always bring in a memory care or assisted living. Usually the corporation will allow for you to bring in a licensed agency caregiver. And that's usually not a problem, 4 hours a day. And then you could say, hey, could you take my mom out for a walk in the wheelchair, a stroll? Could you maybe play one-on-one cards with her because she can't focus in a group? Could you maybe take her to the piano and play a few tunes, place headphones on her, just that one-on-one care that you really can't get because you don't want your mom to go to the other level of care. That's usually an alternative. So again, have realistic expectations. If your mom was losing weight at home and she moves into a large facility, most likely she is going to eat better. Hopefully she is going to gain weight, but not everyone. She's probably not going to gain 20 pounds unless this new physician, you're using their new geriatrician and he's brilliant and he's thinking, gee, we missed a UTI which was causing weight loss, or we missed that she was depressed. And so maybe this new physician can have open eyes, a new viewpoint, and he might find something. That's quite possible, especially if they have a good physician. However, sometimes if she was losing weight at home, she may continue to lose weight in the new facility. Again, realistic expectations. Another issue often is whether or not my mom is really going to improve cognitively. Like a lot of places say, a lot of people move in and get better. You know, that probably is true because they weren't taking their medications at home. Maybe they weren't getting out in the sunshine. They weren't getting the vitamin D they needed. They weren't getting the social interaction that really does help with depression and aging. So quite possibly, could they improve? Yes. But does everyone improve cognitively and socially? No. So just check in. Sometimes it's a trauma for an older adult with Alzheimer's to move just because of the reason that it's change. It's a change, and it might take them a while to get back to their baseline, and then hopefully they'll be just fine. But again, depending upon the dementia, if it's a more severe dementia, such as frontal temporal lobe or Lewy body, they may not improve. But will they be safe? Will they be comfortable? And will they be loved? Those are the key issues we really need to focus on. So have a wonderful day, and email me anytime if you have any questions.